Good morning, Facebook. Happy Friday. Hope everyone's doing great. Today's Facebook Live, I think it's going to be a lot of fun. We are doing Botox. And what Botox does is it paralyzes the muscles up here to stop moving and to prevent those wrinkles. Botox at the Center PC costs $12 a unit. And on average, patients have between 30 to 50 units. So if you can look at that, that's like $300 to $600 a treatment. You must have every 3 months to keep that Botox going. So you're looking at about $2,000 a year to have your Botox done. If you have any questions, comment in our Facebook Live, and we're excited to show you what Botox is. So here we go. Good morning, Facebook.
Did you get the connection?
I did.
Oh, excellent. Oh, we're happy now. Hi, everybody. We're going to welcome you to our Friday live fights. Today's bout is between Botox and our patient Barb here. Barb is interested in attenuating or fixing some of the wrinkles in the forehead area. So I think it's important to understand primarily what Botox is. A lot of people get confused because they think Botox is a type of filler material, and it really isn't. Botox is what we call a neuromodulator. That's a fancy word for a medicine that is made up of botulism toxin A, which is a paralyzer. It paralyzes muscle. It blocks the nerve from firing the muscle. So in our world, in the cosmetic world, muscle pull is responsible for a lot of the wrinkles that we see. It's responsible for some of the wrinkles on the crow's feet. It's responsible for the forehead, the mean 11s here, the crinkly cross wrinkle that you can get on your nose. There's also a couple of other areas on the face that we can use it. It's been around forever. Botox has been used forever in medicine for different things like spastic disorders and what we call wry neck or a spastic neck. I mean, neurologists have used it for years. We've been using it in the cosmetic arena, however, for quite some time now. And it's very safe. You can't be allergic to it. You usually don't react to it at all. And it works nicely on wrinkles. So today we're going to take a look at Barb. And Shane, I'm going to ask you to go around the other side to get a better look. So when we start to think about what we're going to do, we kind of look at this map. And this is a map that kind of tells us where all the facial muscles are. And this is going to help us determine where indeed we're going to put Botox today for Barb. And a lot of it's really going to be predicated on what she wants and what's bothering her. We certainly don't want to give her that frozen face look, but by the same token, we want to kind of get rid of everything that we're dealing with her. So what Barb tells us now on her face is, now I'm going to have her give me the mad face. So what we can see across Barb when she scowls is you can see these little vertical wrinkles that occur right here on the face. You can see these cross wrinkles, and then when we start to think about what muscles are causing those 11s, those mad wrinkles, are really caused by these two muscles called the corrugator muscles. So we're going to paralyze those by putting little Botox in the head of the corrugators. This vertical muscle here is what we call the procerus muscle. That's what gives Barb these little cross wrinkles. So we're going to put a little Botox in there to help ease that up and soften that. Now, as Barb elevates her eyebrows, you're going to see these nice wrinkles that go across here. And what we like to do with Botox is come up the forehead a little bit. Now, that is an off-label use for Botox, but it's used quite frequently in this place. What we want to be careful, though, is we don't come any wider than her pupil, because there's nerves and other things over there that could be affected that we don't want to be affected. We don't want to have the Botox effect. But you'll see this is called our frontalis muscle. That's the muscle of the forehead, and that's what creates those wrinkles. So we're going to lightly just tap that a little bit with Botox just to smooth it out a little bit. If we paralyze it too much, Barb won't be able to elevate her eyebrow at all in the middle. Actually, it can actually droop. And in some people, that can be dangerous. So, and also, we don't want to paralyze this part of her eye and then not this part, because then they end up looking like Spock. So, we'll do that. And then, last but not least, this circular muscle around her eye, that's the orbicularis oculi muscle. That's the one that makes us squint. And it's really good to just locally come in here and affect the crow's feet area by just paralyzing a segment of that small muscle there that helps relax that. So that's what we have planned for you today. Anywhere else you want us to address?
Well, I'm concerned about this area here, but you wouldn't use BOTOX, right?
Typically we don't use BOTOX around the mouth for obvious reasons. We can use some filler materials, we can do some CO2 laser to help smooth this area out. On occasion we can just, if it's really a problem or there's some asymmetry, we can segmentally put a little BOTOX in the muscle that goes around the mouth. Sometimes we'll put some BOTOX up under the eyebrow here to help elevate it, because we can, if we paralyze the depressor, then the elevator comes up. Sometimes we can do little platysmal bands down here with some BOTOX, which helps as well. We can also, you can see these little muscles laterally here. These are called the depressor muscles of the corner of the mouth. If we paralyze those a little bit, we can actually turn a smile up a little bit. We don't make you look like the Joker or anything, but we just do it with, we do it very, very minimally. So what we'll do today is we have our BOTOX all diluted and drawn up. And it's a pretty quick and easy treatment to do. We'll turn a bright light on here. I hope that doesn't mess with the camera. But it's a pretty easy treatment. I'm going to have Barb just kind of tilt back a little bit like that. You can see her face. She's got great bone structure. So we're just going to do a little alcohol wipe here.
Can we turn it off? Possible?
We can.
Sorry.
She won't mind if I don't see
There you
where I
go.
inject
That's fine. We're good.
Oops. No.
Now, what is, I get this question a lot, Dr. Downs, what is the difference between BOTOX, Xeomin, and Dysport?
It's the way that they're made. BOTOX is kind of the Kleenex of this type of treatment. Everything's a Kleenex, right? But that Kleenex is really a brand. BOTOX is a brand. It's botulism toxin A. There's other companies that put it out on the market, Xeomin. If you talk to the companies, it has to do with the way that it's bound to proteins and how long it lasts. So it's really the active ingredient, however, is the same thing.
Okay.
So without getting too technical, that's the best way to understand it. So the big thing with BOTOX, the big risk with BOTOX, is that you get it somewhere you don't want it. Okay? So the place we don't want it is on her levator muscle. The levator muscle is the thing that makes your eye blink. So we put a little thumb right there so I can, A, feel where this corrugator muscle is, but also keep it from leaching down onto where I don't want it. So the first thing we do, and this corrugator muscle is interesting because it's the only muscle in the face that's innervated from underneath. So that's the only part of BOTOX you're going to hear this, Barb. It's a little bit of, it doesn't hurt, but it's a little bit of a crunching noise, and that's because I'm going right down almost to the bone, and I'm putting a little bit of BOTOX in there, into the head of the corrugator, and that's all there is really to it. Now, was that painful? Or?
No, not at all.
And it's a really tiny little needle, and it's very, very sharp, and it goes right in. And sometimes you get a little bleeding. That's normal. So that's those two areas.
And how long does it last?
Typically, depends on the area of the face, but typically we like to say between 6 and 9 months. But usually if we're doing BOTOX on someone, we like them to come in every 3 months and get a little bit of BOTOX, and that helps it. Because the whole idea here is to avoid the wrinkles of the skin, so they don't, because the longer that you have that muscle pull, the higher the likelihood is that you're going to have permanent wrinkling. So we've got the corrugators, we've got the procerus, and I'm going to have you elevate your eyebrows again, and you can see these wrinkles. So we're going to just come right up under the skin and go right up the middle portion of her forehead. With a little bit, I'm putting about 1 unit in each one, or 2 units in each one of these little areas. And that's going to help smooth out that central portion, but I'm not putting too much in, because what I don't want is that complete deadpan look. Now you'll see when she elevates laterally, she gets these little bit of wrinkles here. Now typically I don't come past the forehead, the pupil, but in this particular case I'm going to put a little bit up in here to help just knock down that lateral eyebrow a little bit.
And if I'm correct, BOTOX is FDA cleared for migraines and sweating, correct?
Yeah, it is. We can use it in the armpit and hands for what we call hyperhidrosis, which is, you know, that excess sweating. And it works really well for that. It just paralyzes the little muscle that makes the sweat gland work.
So Tracy just asked, is that 1 unit how much? So Tracy, a unit is $12 at the center PC, and roughly most average patients use between 30 and 50 units. So that's an average between 350 to 600 every 3 months.
So what we're going to do with Barb is we're going to be real careful because she's got kind of a prominence to the veins here around her eyes. And you can get a little bruise from Botox at the site of injection. That's not a big deal, but we try to avoid it if we can. So I'm going to try to avoid the number of pokes that I put. So I'm not going to put a poke in each one of these little wrinkles. What I'm going to do is just kind of come underneath into the muscle and then fan about 5 units through there and then massage it with my thumb. And that'll spread it around where I want it instead of risking multiple needle sticks around a very thin, sensitive area, and then I can avoid that vessel.
And what is the downtime with
There's no
Botox?
downtime. From an exercise standpoint, we ask that you don't do anything strenuous for about 48 hours. Nothing that's going to increase your blood pressure, your heart rate, that kind of thing. We ask that you don't massage where we've injected because we don't want to, again, spread the Botox around to an area we don't want it.
What about sleeping?
Don't sleep. You can sleep. It's fine. Just don't sleep on your face for first night. And these are just actually that's a little bit of overkill. I mean, really after the first couple hours, the Botox really is not going to go anywhere. So
now someone always
you can really. I mean, I think the worst thing in the world is going to sleep at night and trying to figure out not to try to sleep on your face. I don't know about you, but I end up in positions you never really, you're upside down half the time. You don't even know you're going to be there.
Now, something that I think is a misconception about Botox is it does not work instantly.
No, it's a good question. Botox takes about we say it works between 2 and 10 days. So what that means basically is that you'll see initial effect starting in about 48 hours, and then it'll reach maximum in about 10 days. Now, you don't have to go out and make all kind of weird faces for the next 48 hours trying to get this stuff to work. It's going to work all on its own. The only thing we don't want you to do is press here, massage anywhere near your forehead area because we don't want to spread it onto your. So you can see little tiny needle marks. They'll go away in about an hour. Sometimes you can get a little tiny bruise, and if that happens, a little bit of, it's usually a very spotty area, and you can treat that with a little bit, just a little makeup. You can put makeup on this in about an hour, and you'll never even know you're injected. And that doesn't take long. I took my time because I was explaining. So the typical Botox treatment when we're doing a forehead and eyes area like this, probably about 5 minutes, really. So we would ask for Barb to come in about every 3 months, just prophylactically get a little treatment, and that'll work nicely. So what we're expecting to see is that kind of result there on the forehead to spread things out very nicely, and then on the crow's feet, it just relaxes the crow's feet very nicely. And it works beautifully.
So I have a really good question from Alina. She says, I'm 24 and I've always wanted Botox. Is that advised? A lot of people ask that. Do I wait till I get wrinkles to get it? Actually, it's better to try to do it prophylactically before those wrinkles hit. And again, the wrinkles that we see are either wrinkles that are inherent to the skin, or they're going to be wrinkles that are as a result of expression. Now, we don't want you to be expressionless. Obviously, when you smile and things like that, you're going to have marks on your face from the expression. However, over time, if you have real strong muscle pull, those little wrinkles after you relax, they don't go away. They stay in the skin. So if you can just meter those or temper those a little bit, even when you're younger, it's almost prophylactic in terms of keeping them from cropping up on your face as you get older. So it's usually better to start early with that, not wait till everything gets really bad. By that time, you can't prevent the wrinkles. So Jim says hi, and he says, you're the greatest doctor, feeling great after surgery on Tuesday. You're the man.
Thank you, Jim. But that's Botox. What did that feel like?
Oh, it didn't hurt at all. It's fine.
Right. So things we watch out for a little bit of, what's the worst thing you can have with Botox? Again, getting that stuff somewhere where you don't want it. The biggest thing is what we call an eye droop. It's not even that big of a deal, but what we can do at that point then is there's some eye drops and stuff that we can put in to easily treat that. And remember, Botox is not permanent. It will last 6 to 9 months, and again, we recommend about every 3 months that you get treated. And a lot of our patients get on just a rotating schedule where every 3 months they come in, they spend about 5 minutes with us. That's not all
And
it
I've
takes.
always been told that if you are regiment on 3 months, the less you have to really spend because you don't need as much units.
Well, typically,
right?
the stronger the muscle pull, the more Botox we have to put in to paralyze it. So if you're every 3 months, we can put what we call a maintenance dose, which ends up being about half of what we would normally do if you had no Botox on board whatsoever. So for instance, with Barb, we put in probably about 32 units, and typically if she came in every 3 months, we'd get away with about 25. So, but it's been what you said, 6 months since your last treatment. So she's almost fully back from her with her contractions. So we used a little bit more today, but I probably would get away with about 25 units for her if we were doing it every 3 months.
Okay. And maybe we can have Barb back another Friday to talk about fillers, because I know that's something.
Well, evidently
Barb's
she wants to
interested.
talk about fillers. We can do that. Yeah, I mean,
Yeah,
she's
you
a perfect,
do.
she's a perfect person for it. She has great bony structure, great skin, and all we have to do is just reinflate some of those cheeks. So there's some really good conversations we can have in terms of fillers for you.
I would love that.
No pressure, Barb.
No pressure.
And then we could do a little CO2 laser, and oh
I
man.
need the works.
Well, you've
Full
been
day.
you've been a trooper with us this afternoon, so thanks for allowing us to share your Botox experience with
Thank
the
you.
world. So
Should we say go Notre Dame?
somebody ought to say it.
Yeah.
All right. Anything else from the doctor?
No, we'll say it. Go Irish. But have a great weekend, everybody, and we'll hope to see you next Friday at our Facebook Live.
All right, guys, so that's our Facebook Live today on Botox. Again, the price is $12 a unit, and average price per 3 months is $350 to $600. So if you're interested in having Botox done, you can give us a call at 574-968-3510 or visit our website, thecenterpc.com. That's RE, like the British way. And also, if you share, like, or comment this video, you'll be entered into our $50 Visa gift card raffle that we will draw live next Friday. So we hope you guys have a great weekend, and we will see you next Friday. Bye, guys.